Hello everyone, I am Dr. Vijay K. Rao, consultant rheumatologist at Divisha Arthritis and Medical Center, Bengaluru. We will learn about lupus or SLE, systemic lupus erythematosus. Lupus in Latin means wolf bite. Earlier days in historical era, people thought that the rash resembled a wolf bite. So, what is this disease about? I often call this a fire. For fire, you need wood, you need kerosene, and you need matchstick or a lighter. Wood are your genes. A genetically predisposed individual, if exposed to sunlight, which is the matchstick, and if kerosene is poured, that is your hormone. So, female hormone fluctuation, which happens in puberty when a girl becomes a lady, and during pregnancy or delivery when a lady becomes a mother, or menopause when the lady becomes a grandmother. So, these are the changes which can cause hormone fluctuations such as estrogen excess and lupus comes. So, this causes early morning joint pains or joint pains throughout the day. Not much of swelling, but some patients can have swelling in the hands, feet, shoulders. Worse in the mornings or later half of the night, worse with rest, better with activity. Can also cause severe profound hair loss where clumps of hair might come out, and patients can often have malar rash or butterfly rash when they exposed to sunlight, or sun induced rashes on the forearms or feet also. So, these are called photosensitivity rash. And mouth ulcers, severe mouth ulcers, lack of appetite, weight loss, high fevers. Patients often get initially tested for infections, tuberculosis, cancers. When all the tests come back negative, the treating physician thinks that whether this could be an autoimmune disease such as lupus or SLE. It can also cause anemia or low blood count, low hemoglobin, which is not corrected by any iron deficiency, where the blood cells of the RBCs start splitting out, called hemolysis. It can cause low white count, where your fighting cells or immunology cells become low, low lymphocytes, low neutrophils, thereby patients start having repetitive infections. Low platelets, which are main blood control cells, and patients start having rashes or due to bleeding, gum bleeding when they're toothbrushing, excessive period bleeding, can all happen because of this. It can also cause accumulation of fluid around the lungs called pleural effusion or pleurisy. Can have breathing difficulties. Very rarely lupus can cause pneumonitis, that's not very common as opposed to scleroderma. Can affect the heart, where the covering of the heart called pericardia get affected and fluid can collect around the heart called pericardial effusion. And breathing difficulty, fast heart rate, low BP or high BP, can any of these can be happening. Can affect digestion, causing blood in the stools, diarrhea, or pain in the abdomen of eating food. It can affect any of the reproductive problem, causing early pregnancy losses, that is abortions, or low birth weight babies, early deliveries, so on and so forth. So, when any of these symptoms are there, rheumatologist or a physician trained in immune mediated diseases checks a blood test called ANA, anti-nuclear antibody, and 99% of SLE patients have ANA positivity. My professor, who is a lupus expert in Birmingham Lupus UK Center of Excellence, Professor Caroline Gordon, used to always say, make sure you are very careful if you make a lupus or SLE diagnosis in an ANA negative or normal patient. So, it is essential that ANA should be positive and should be done by the right method called ANA immunofluorescence or IF, where they check for antibodies through immunofluorescence microscope, and based on that a diagnosis is happen. So, after the diagnosis, a rheumatologist treats the patients with tablets, of which steroids will be initial for moderate to severe lupus. Not all patients will be severe. If it affects the brain or the kidney, it is severe. If it affects the blood and other organs, it is mild to moderate. So, other tablets such as methotrexate, hydroxychloroquine, azathioprine, mycophenolate, tacrolimus, cyclosporin are all used by the rheumatologist along with steroids. Steroids are stopped within a month, month and a half, and other tablets are continued for a minimum period of 2 years. Tablets take time to work, 3 to 4 months, but slowly tablets can be reduced beyond 1.5 years, but minimum dose of hydroxychloroquine is recommended for a long period of time. Sunscreen lotion has to be used all through the life in the sun exposed areas, even if inside the house, because any amount of light passing through the glass can trigger this. And make sure tablets are not stopped suddenly. low fat, low sugar, no red meat, that is no mutton, beef, pork, and 30 minutes of physical exercises, aerobic exercises, very less sitting, frequent mobility, half an hour of walking is mandatory. More than everything, positive mental attitude, a will to get better, and strive to achieve to normalcy despite all hardships is what will make you go through this diagnosis. You will get better with the right treatment and perseverance. I wish you all the best. Thank you very much.